A very good day, my dear postgraduate students. Welcome to SNIP, Short Notes in Pathology. I've already told you that you people can score more percentage of marks in the short note than an essay. The topic for the day is glycosylated hemoglobin. This is a university exam question. Let us see how we can answer. Glycated hemoglobin is a form of hemoglobin that is measured primarily from the 3-month average plasma glucose concentration. So it is a 3-month average. A value of it has got an effect for over 3 months. The test is limited to a 3-month period, the average, because that is considered to be the average lifespan of an RBC. Please remember it. Overall, the RBC is supposed to be having a maximum span of 120 days. But on an average, it is 3 months, and hence that is taken as the denominator. It is formed by the non-enzymatic glycation pathway by the hemoglobin on exposure to plasma glucose. This will be explained subsequently. Let us have this in mind. The principle is the glycation of the protein is a frequent occurrence, but in the case of hemoglobin, a non-enzymatic reaction occurs between the glucose and the end of the beta chain. This forms the base for the conversion of the shift base to the 1-deoxyfructose. Please by heart this particular page. It is more of biochemistry than pathology. Hemoglobin is a protein that is found in the RBCs, and HbA1c is used to evaluate a person's value of glucose control. It is not a diagnosis of diabetes, but then it is your capacity to control glucose. It reflects the RBCs present in the bloodstream at the time of test. The average blood sugar value over 90 days is also reflected in this test. It can be used to diagnose diabetes, but more than that, it is your control over diabetes that matters. And the lifespan is for 3 months of the RBCs. That is the average lifespan. That is the period of the test also. The significance is hemoglobin carries oxygen from the lungs to the tissues, and the hemoglobin becomes glycated or coated with the glucose present in the bloodstream. The glucose attaches to the Hb protein, and the increased glucose level reflects on the surface of the Hb protein, leading to a higher A1C level. Look at this one. It is the optimal, elevated, and the high values. Optimal is less than 5.7%. Elevated is somewhere between 5.7 to 6.4%, and high is more than 6.4%. Below elite. And this again is a reflection of the same, thanks to PACE hospitals for this picture. But this is more important from the care hospital. This is the RBC, and I find that it has got the hemoglobin, and there is the HbA1c that is being produced from the glucose, and it glycates the hemoglobin. So glycated hemoglobin or glycohemoglobin is being formed. This is being measured. So the hemoglobin is being carried in the form of oxygen to the lungs, and then to all the cells of the body. It gets coated with this, glycated, and there is an increase in the glucose level that will be reflecting the increase in the amount of protein on the surface. HbA1c levels are increased in uncontrolled diabetes. Please do remember this. This is a very important diagram and immunoassay. Always you find that there is a solid support over here, and this is supposed to be indicating the glycated pentapeptide. It is over here, and it is more of a sandwich technique that is being used. So HbA1c in the sample contains only HbA1c, or it can be a mixture of HbA1c and HbO. So this is what is happening over here. So it is a sandwich technique, and God is over here. God means you find that glucose oxidase. It gets attached, and there will be a substrate, the HRP or the horseradish peroxidase, which produces a blue color for the measurement of it. So this is one of the methods by which it is done. It is more like the principle of an ELISA. Always you will have a solid support, then an antibody is being added, an antibody to the antibody along with the coloring substrate which is being measured. And there are other methods also. One is the high performance liquid chromatography. I would like you people to kindly mention these. So in this one, there is a profile of the patient's HbA1c. What is the etiology and epidemiology? There are various organizations which have evolved it and which are controlling it. For example, DCCT, Diabetes Complications and Control Trial. It produces the importance in the diagnosis and control of the HbA1c. Increased glucose level is reflected by this. NGSP, National Glycohemoglobin Standardization Forum. IFCC, International Federation of Clinical Chemistry. ADAG is A1C derived average glucose. These things you people should know, not for the sake of the answer, but tomorrow you are a pathologist who is going to direct the entire laboratory, and the other disciplines might also be coming under you. So less than 7%, there can be microvascular complications such as retinopathy, nephropathy, neuropathy, etc. in type 1 diabetes. But if it is more, it will be worse. Benefits of lowering the cardiovascular risk and the mortality is done by means of this particular one. Stable patients should be having the HbA1c check twice yearly, whereas uncontrolled people, the medications, they should have it done at least thrice a year. And there are various tests. One is called the point care test or the TAT, and the other one is capillary finger prick. Venous EDTA blood, it's being used, or the whole blood can be used. So this is one. So HbA1c, you find that this is the value. There are the others over here. And this itself is a capillary method or the one that is formed by Terra or Sebia. The problem with this is there can be inaccurate results in the case of sickle cell anemia, thalassemia, liver disease, etc. Hence, a complete clinical history is mandatory. Because in these conditions, there is going to be the longevity of the RBCs which are very much decreased. So sickle cell anemia, for example, a full-blown anemia can be having a lifespan of, RBC can have a lifespan of 8 to 20 days. Falls low in a case of pregnancy, hemorrhage, blood transfusion, iron supplementation, and any form of hemolytic anemia, kidney failure, liver failure, cirrhosis, etc. So a complete panel of the clinical history is mandatory. Vitamin C therapy also can increase or decrease the values. False high values you people can get whenever there is a lack of iron and whenever there is some tumor that is present. Other causes can be hypertriglyceridemia, transplantation, hyperglycation. And medications such as immunosuppressants can also lead to false high values. So these are things, the interfering factors is a hazarding. You people will have to write all this. And this is again the HbA1c equates. What happens is about 6 means then the average blood glucose. If it is going to be 8, then it is 183. If the HbA1c is 10%, then it is 240. So there is the percentage which is reflecting on the blood glucose. It serves as an indicator of the overall glycemic control by the patient. But if you are asked a question like this, writing the pure biochemistry is one part of it, but if you are a clever student, how can you expand your answer? You mentioned the types of diabetes, what can be the methods of the laboratory diagnosis, not in detail, but you'll have to know the names of the methods by which they are being done. And then what can be the complications of uncontrolled diabetes with a high HbA1c. These things we'll have to write so that you get that additional 1 mark which I require. You will never get anywhere if you do not do your homework. A wonderful saying. Such short questions we'll have to sit and read, sit and take the notes. And I always used to say that your notes is the Bible, not my class. Gracias.